A resurging threat understanding measles in 2025. Measles is back. This highly contagious viral disease was once considered eliminated in many parts of the world. Now it's making a comeback. Measles is a serious threat, particularly to young children. It can lead to complications like pneumonia, encephalitis, which is brain swelling, and even death. The virus is easily spread through the air when an infected person coughs or sneezes. The telltale signs of measles are hard to miss. They include a high fever, cough, runny nose, and red, watery eyes. A few days later, a characteristic red rash appears. This rash typically starts on the face and spreads to the rest of the body. Measles is so contagious that it can linger in the air for up to 2 hours after an infected person has left the room. The resurgence of measles in 2025 is deeply concerning. It signifies a breakdown in our defenses against preventable diseases. We must understand the factors driving this resurgence to effectively combat it. This includes addressing vaccination gaps and tackling misinformation about vaccines. We must act now to protect ourselves and our communities from this preventable disease. By understanding measles and the importance of vaccination, we can help turn the tide against this global health threat. A global crisis, mapping the measles outbreak. Measles outbreaks are occurring worldwide, with alarming increases in many regions. The World Health Organization has reported a significant rise in cases compared to previous years. This surge is a stark reminder of the critical need for widespread vaccination. In the United States alone, over 600 cases have been confirmed across 22 states as of April 2025. This number has more than doubled since 2024. Texas has become an epicenter of the outbreak, reporting a staggering 481 cases. New Mexico and Kansas follow with 54 and 24 cases, respectively. Australia, too, has experienced a significant surge in measles cases. This is particularly concerning given the country's previous success in controlling the disease. The rise in cases highlights the interconnectedness of global health and the ease with which infectious diseases can spread. International travel plays a significant role in the spread of measles. Travelers from countries experiencing outbreaks can unknowingly carry the virus and transmit it to unvaccinated individuals. This underscores the importance of ensuring vaccination coverage both domestically and globally. Vulnerable populations. Who is most at risk? While measles can infect anyone, certain age groups are particularly vulnerable. Children under the age of 5 are at the highest risk of contracting the disease and developing serious complications. This is especially true for infants who are too young to be fully vaccinated. According to recent data, 157 cases of measles have been reported in children under 5. This is followed by 180 cases in children aged 5 to 17 and 87 cases in adults over 18. These numbers highlight the need for increased vaccination efforts across all age groups. There are several reasons why children are more susceptible to measles. Their immune systems are still developing, making them more vulnerable to infections. Additionally, vaccination schedules often begin after a child's first birthday, leaving them unprotected in their early months. It is crucial to understand that measles can have long-term consequences, especially for young children. These can include permanent hearing loss, developmental delays, and a rare but fatal brain disorder called subacute sclerosing panencephalitis, or SSPE. Unraveling the resurgence vaccination gaps and beyond. The resurgence of measles in 2025 is a complex issue with multiple contributing factors. However, one factor stands out as a primary driver: vaccination gaps. Years of declining vaccination rates, fueled in part by misinformation and vaccine hesitancy, have created pockets of vulnerability within communities. Herd immunity, the concept that a highly vaccinated population protects even those who cannot be vaccinated, has been compromised. This allows the measles virus to spread more easily, leading to outbreaks. The COVID-19 pandemic further exacerbated the situation, disrupting routine vaccination schedules and diverting healthcare resources. International travel, while beneficial for connecting the world, also plays a role in the spread of infectious diseases like measles. As people travel to and from regions experiencing outbreaks, they can unknowingly carry the virus across borders. This highlights the need for global cooperation in disease surveillance and vaccination efforts. Addressing the measles resurgence requires a multi-pronged approach. This includes strengthening vaccination programs, combating misinformation, and promoting public awareness about the importance of vaccines. It is a collective responsibility to protect ourselves and future generations from this preventable disease. The MMR vaccine, your best defense against measles. The measles, mumps, and rubella vaccine is incredibly effective in preventing measles. 2 doses of the MMR vaccine are 97% effective in preventing measles, while 1 dose is about 93% effective. The vaccine works by triggering the body's immune system to produce antibodies against the measles virus. These antibodies provide long-lasting protection and prevent future infection. The CDC recommends that children receive their first dose of the MMR vaccine between 12 and 15 months of age, and the second dose between 4 and 6 years of age. Adults who are unsure of their vaccination status should consult with their healthcare provider. The MMR vaccine is safe and has been rigorously tested. Side effects, if any, are usually mild and may include soreness at the injection site, low-grade fever, or a mild rash. The benefits of vaccination far outweigh the risks associated with contracting measles. Choosing to vaccinate yourself and your children is not just a personal decision. It's a decision that impacts public health. By getting vaccinated, you're not only protecting yourself, but also contributing to herd immunity. This protects those who are unable to be vaccinated, such as infants and individuals with certain medical conditions. Herd immunity is crucial in protecting those who cannot be vaccinated, such as newborns or individuals with certain medical conditions. When a significant portion of the population is immunized, it reduces the overall amount of the virus able to spread. Absolutely, Marie. Vaccination not only protects the individual, but also helps protect the community. However, vaccine hesitancy remains a significant barrier. It's essential to address concerns and provide accurate information to those who are hesitant. I agree. Misinformation can spread quickly and create fear. By sharing our own positive experiences and the facts about vaccines, we can help combat hesitancy and encourage more people to get vaccinated. When traveling, it's important to check if measles is prevalent in your destination. Make sure you're up to date with your measles vaccination before you go. That's right, John. Also, practice good hygiene, such as frequent hand washing and avoiding close contact with sick individuals, to minimize your risk of contracting measles. When our child was diagnosed with measles, it was a terrifying experience. We realized how important it is to seek medical advice early on and ensure vaccinations are up to date. Consulting with healthcare professionals can provide guidance tailored to your specific situation, ensuring you and your loved ones are protected against measles. Each of us has a role to play in preventing the spread of measles. Stay informed, get vaccinated, and encourage others to do the same. Together, we can protect our communities and future generations from this preventable disease. Thank you for joining us on this journey to understand and prevent measles. If you found this video helpful, please like, share, and subscribe to our channel for more similar content. Your support helps us reach more people with vital information. Stay connected, stay informed, and together, let's make a difference.